Malaria is a disease of the blood that is caused by the Plasmodium parasite. It is transmitted to people by a particular type of mosquito. There are more than 100 species of the malaria parasite. The most deadly and common is in Africa and it is known as Plasmodium falciparum. When the parasite enters the human body, it lodges itself in the liver where it multiplies about 10,000 times. 2 weeks after the parasite enters the body, it bursts into the bloodstream where it begins infecting our red blood cells. Symptoms begin 10 days to 4 weeks after infection. A person may feel ill as early as a week later. Some symptoms can be fever, headache, and vomiting. If medicine isn't available or if the parasites are resistant to them, the malaria infection can become anemia, hypoglycemia, or cerebral malaria, in which capillaries carrying blood to the brain are blocked. Cerebral malaria can cause coma, lifelong learning disabilities, and death. Because the malaria parasite is found in red blood cells of an infected person, malaria can also be transmitted through blood transfusion, organ transplant, or by sharing needles or syringe contaminated with blood. Malaria may also be transmitted from a mother to her unborn child before or during the delivery. Attempts at creating an effective malaria vaccine and vaccine clinical trials are still going on. Malaria parasite is a complicated organism with a complex life cycle. The parasite has the ability to evade your immune system by constantly changing its surface. So developing a vaccine against this varying surface is very difficult. Scientists do not yet totally understand the complex immune responses that protect humans against malaria. However, many scientists all around the world are working on developing an effective vaccine. Unfortunately, because other methods of fighting malaria, including drugs, insecticides, and insecticide treated bed nets, have not succeeded in eliminating the disease, the search for a vaccine is considered to be one of the most important research projects in public health. According to the Africa Indoor Residual Spraying Project website, it is estimated that malaria cost Africa about $12 billion per year in direct cost and reduces GDP growth by 1.3% annually. Define that this disease costs a great percentage of African economy. Malaria or a similar disease as malaria has been noted for more than 4,000 years. The disease was discovered in the year 2700 before Christ by the Chinese, but was well known in Greece by the 4th century before Christ. People were trying to be 100% sure that the fever and headaches were really part of the disease of malaria. When they noticed it wasn't the flu, people started to search for treatments for the disease and started to notice that the disease was transmitted by an insect's bite.
Malaria became very recognized in Greece by the 4th century before Christ and was responsible for the decline of many city-states' populations.
Globally, the World Health Organization estimates that in 2013, 198 million clinical cases of malaria occurred, and 500,000 people died of malaria, most of them children in Africa. Because malaria causes so much illness and death, the disease is a great drain on many national economies.
Since many countries with malaria are already among the poorer nations, the disease maintains a vicious cycle of disease and poverty.
As it was said before, malaria has been present since many years ago. It is called ancient disease by the name we know. That means it is not new. It has just evolved. It wasn't long ago when they discovered it was transmitted by mosquitoes. But now, in the 21st century, there is more concern for the disease because in the past years it had been estimated at 198 million of malaria cases and 5,084. It is also said that 3.3 billion people in 97 countries are in risk of malaria, which is nearly half the world's population. One of the main things that companies or countries are focusing on is in a vaccine, which is not yet invented. Currently, in the 21st century, malaria mosquitoes have been increasing because of the pollution of our world is creating. By this, I mean ponds, lakes, and rivers. Also, part of this is increasing malaria because of poverty. As you know, poverty has been increases every year, and this is just another cause which brings more and more malaria cases. Because it is estimated that malaria cases will increase more money is being invested by countries which have more probability to have major rates of infected people. These cases could be near Africa, since it's where most malaria cases are being reported. What has also made researchers put more attention in this issue was that every year certain population is dying of this, and as I said, it is estimated that it will keep growing. A study made this year said that if they continue working and taking preventing actions, the malaria cases were going to start decreasing. Its major objective is eradication, but it is too hard to do this, and it will take a long way until this is accomplished. European countries are contributing in several ways. They are making conferences or are researching with schools that specialize in this, that are from all around the world, that will help find other prevention methods and possible solutions for malaria.
Where does it take place? Where malaria is found depends mainly on climate factors such as temperature, humidity, and rainfalls. Malaria is transmitted in tropical and subtropical areas where Anopheles mosquitoes can survive and multiply, and malaria parasites can complete their growth cycle in the mosquitoes. Temperature is particularly critical. For example, at temperatures below 20 degrees Celsius, Plasmodium falciparum, which causes severe malaria, cannot complete its growth cycle in the Anopheles mosquitoes, and those cannot be transmitted. In many malaria endemic countries, malaria transmission does not occur in all parts of the country. Even within tropical and subtropical areas, transmission will not occur. At very high altitudes, during colder seasons in some areas, in deserts, or even if the countries where transmission has been interrupted through successful control elimination programs. Even generally in some regions closer to the equator, transmission will not be intense and malaria is transmitted year round. The highest transmission is found in Africa south of Sahara and in parts of Oceania such as Papua New Guinea. In colder regions, transmission will not be less intense and more seasonal. There, PVVAX might be more preventable because it is more tolerant of lower ambient temperatures. In many temperature areas, such as Western Europe and United States, economic development and public health measures have succeeded in elimination of malaria. However, most of these countries have Anopheles mosquitoes that can transmit malaria, and reintroduce of the disease is a constant risk. The construction of irrigation systems and reservoirs in some parts of the world can have a dramatic impact on malaria distribution and in the intent of its transmission. Around 40% of the global malaria deaths occur in two countries, Nigeria and the Democratic Republic of Congo, the WHO said. Malaria is a risk for more than 90% of Nigerians' population and contributes also to estimate 11% of maternal mortality. There are estimated 100 million malaria cases with over 3,000 deaths per year in Nigeria, about 100,000 more than the deaths of HIV or AIDS. 3.4 billion people live in areas at risk of malaria transmission in 106 countries and territories. The World Health Organization estimates that in 2013, malaria causes 180 million clinical episodes and 5,000 deaths. Geographical location of the issues through a map. Africa, Nigeria, Republic of Congo, Mozambique, Burkina Faso, Sierra Leone.
The type of factors that support the anti-malaria campaign are the United Nations, whose role are campaigns, actions, programs, activities, and results. The United Nations has created a campaign named Nothing But Nets. It's a global and grassroots campaign to raise the awareness and funding to combat malaria. This campaign has a partnership with the National Basketball Association and others. The campaign has raised more than 35 million and they have engaged hundreds of thousands of supporters all around the world. They have distributed more than 4 million life-saving bed nets in 25 countries in Africa. The CDC is a governmental USA organization which has the most advanced disease control technology and they investigate for a cure to this problem in Africa. Nets for Life is a non-governmental organization which raises awareness of malaria. This organization is made up out of some corporations, foundations, some other NGO, and faith-based organizations such as churches. They have implemented malaria prevention programs in 12 countries in sub-Saharan Africa. One organization that is aware of the UNICEF, another is the World Health Organization, the UNDP, United Nations Development Program, and the World Bank of the Rollback Malaria. Another campaign is the Against Malaria Foundation. It's a multinational corporation which its role is to gain money to help victims of malaria. African Fighting Malaria is a non-governmental organization. They try to raise awareness and gain money from donations to help people in Africa with malaria. ISO Malaria is a state and non-state organization which helps African people with this disease. I say it's more a state actor because it's formed out of people and cities of the same country, and it's always trying to help their people and raise awareness. Fighting Malaria for fighting a stronger economy is a multinational corporation which is involved in Africa for fighting malaria and helps with medicines and raising awareness in the cities.
Malaria is an economic conflict because malaria causes so much illness and death. The disease is a great drain on many national economies. Malaria and poverty are intimately connected. It's both a root cause and a consequence of poverty. Malaria is most intractable for the poorest countries in the world. Malaria affects the health and economic growth of nations and individuals alike, and is costing Africa about 12 billion a year in economic output. Studies show that malaria endemic countries in Africa have growth rates up to 1.3% less than other countries that are not malaria endemic. Some negative impacts can be undeveloped markets due to traders' unwillingness to travel and invest in malaria endemic areas, an undeveloped tourist industry due to the reluctance of travelers to visit malaria endemic areas. Since many countries with malaria are already among the poorer nations, the disease maintains a vicious cycle of disease and poverty. There were about 198 million cases of malaria in 2013, and most of them were in Africa. 78% of the deaths caused by malaria were of children under the age of 5. Malaria is a very powerful disease because it can kill within a 24-hour symptom onset. Africa is a continent with the largest amount of countries that have a problem with malaria. The two principal countries are Nigeria and the Democratic Republic of the Congo. Nigeria has 39% death rate thanks to the malaria, and Democratic Republic of the Congo with a very high death rate.
Countries have long since tried to solve the malaria disease. Some attempts to reduce the mortality rate due to malaria are the following. Timely diagnosis. Rapid diagnostic tests are expanding the world's ability to confirm malaria cases in remote settings, ensuring that people get the right treatment when and where they need it. Treatment. Artemisinin-based combination therapies are the frontline treatment for malaria. A full course of life-saving malaria treatment costs just $1 and cures a child in 1 to 3 days. Mosquito nets. Long-lasting insecticide-treated bed nets prevent malaria by creating a protective barrier against mosquitoes at night when transmissions occur and can cover 2 people per net. Vaccines. Scientists and organizations around the world are working together to accelerate the development of a malaria vaccine and ensure its availability in the developing world, but it is still in development. Targeted insecticide spraying. Spraying on the inside walls of homes helps kill mosquitoes and reduce the rate of malaria transmission. Between 2000 and 2013, the global malaria mortality rate dropped by 47%, a major expansion of the WHO recommended core package of measures. Vector control, chemoprevention, diagnostic testing, and treatment has proved both cost effective and efficient. Nevertheless, millions of people are still unable to access malaria prevention and treatment, and most cases and deaths continue to go unregistered and unreported. The new strategy comprises three key elements: ensuring universal access to malaria prevention, diagnosis, and treatment, accelerating efforts toward elimination and attainment of malaria-free status. Strengthening malaria surveillance. It emphasizes the importance of innovation and research and the critical need for political commitment. The sustainable financing strong health systems and collaboration across different sectors.